that's what I try to do in my book, is say, look at your own body. Stop looking at other people's bodies. Like, where's a place you could start? Do you have chronic anxiety? Start there. Like, high levels of cortisol and adrenaline throughout the body throughout the day progresses the disease, not just symptomatically. It is actually a disease provoker. Like, do you eat tons of processed foods and no antioxidants? That can progress disease, because you can't stop inflammation without antioxidants, which is why an antioxidant-rich diet is so important, right? There's all these little things you can do. And with the book, I hope to put the power back in patients' hands, that they're not looking for someone to heal them. They're saying, I can heal myself. I don't have the information. I can partner with people to help get me there. But at the end of the day, I'm taking radical responsibility for myself and for my future.
Hey everyone, welcome back to the Pelvic Pulse podcast. Today we have Katie Edmonds, and she is an endometriosis-focused author, educator, and nutritional therapist. She wrote the 4-week endometriosis diet plan and Heal Endo, an anti-inflammatory approach to healing from endometriosis. Katie lives on the North Shore of Kaua, next to the biggest mahogany forest in the United States. That's actually my partner would really appreciate that fact. With her loving husband and 2 wonderful miracle, in quotes, kiddos, and is absolutely passionate about helping women with endometriosis. Thank you so much for being here, Katie. I'm so grateful that our mutual friend Corey, who also is from Kauai, gave me your book because she knew that I worked with a lot of women with endo. So yeah, grateful that she did that, and so happy you're here.
Oh, I'm excited to be here. And funny, Corey lives on the other side of the mahogany forest.
Oh yeah, true, true,
Like
true.
a bird fly away.
Oh,
Yeah, I'm very excited to be here and talk everything endometriosis.
yay. I mean, there's so much that we could cover. And
Mhm.
I guess if you want to just give a brief explanation, because I was looking through your website like a while back, and it sounds like you were diagnosed when you were 24. And I mean, everyone who
Yeah.
gets diagnosed, it could take years and years and years. 10 years, I think, on average for endo and
Yeah,
PCOS.
that's the average amount. So some sooner, some later, right? You're looking at like 17 years, so they're diagnosed at menopause. So there's some tragic stories out there. Mine was really a quick diagnosis, and it's funny because on Kauai we don't have a great medical care system, but it's a small town, so I would go to the small town doctor. And I think because of that, there's a little bit more of a community vibe. So she didn't write me off when I went in and said I had like terrible pain
Mm.
after some sexual intercourse and the pain wasn't going away. And she wasn't like, oh, birth control. Yeah, I got my next patient. She was like concerned about me. And she's the one that said, it sounds like endometriosis. And I was like, oh, no, 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 it couldn't be. I don't have painful periods. I Googled endometriosis, definitely not. And she's like, I'm going to send you in for imaging. So because of her, I got a diagnosis within like 3 months of my pain. It was a preliminary diagnosis, right? Because one of the challenges of getting an endo diagnosis, then as it is now, although there's some really cool, hopeful testing on the right on the horizon, like
Mm.
we're there right now, basically. But it's to do laparoscopy, so you have to go under anesthesia, and then they blow up your belly like a balloon, insert a little camera through your navel, and take a look around. So it is pretty darn invasive, right? So they're giving most people we suspect you have endometriosis. Now, there's nothing you can do. You can go on birth control. There's no cure.
Mm.
There's really poor treatments. No one knows much about endometriosis. It's caused by estrogen. If, birth control doesn't work, consider chemical menopause. If that doesn't work, let's do a surgery. Maybe then we'll figure out if you have endometriosis. And if none of it is working, then have a hysterectomy. So those are the kind of the stages of healing, I mean, when you call it mitigation of endometriosis. You'll get at the doctor's office that you still get today, as you would have when I went to the doctor, and that was about, gosh, 15 years ago, because I'm
Wow.
39 now. At 24 was my diagnosis. And that's what they would have told my grandmother, right? It's really the same thing. So it's really unfortunate that doctors are not as up to date with endometriosis as they could be. Like on every level. And I'd say that like really graciously. You could say really angry comments there about how how awful a lot of patients have been treated by their doctors.
Mhm.
But I have also met some really kind, wonderful doctors who I could tell cared for me, but they knew nothing about endometriosis. So, there's the good doctors, the bad doctors, but the overarching element is that so few people in our society understand what this disease is, yet it affects so many women. And there are absolutely incredible treatment plans. So it's like if you have cancer, which I thought I had actually. And to go
Mm.
back, I was actually devastated when I found out I had endometriosis, not cancer, because I thought, well, cancer, there's a treatment, and endometriosis doesn't have one. So I could, maybe I could be treated with cancer and go in remission. So we literally can say the same thing about endometriosis. There's treatment plans that work. You aim for remission. You want all of your symptoms to go away. You want that endometriosis to be a thing of the past. And then you just keep checking, you keep on top of it to make sure it's not coming back. Right. But you're not just treating and managing this chronic issue and complaining to the metaverse. There's no cure. There's nothing we can do because there is, but the information is challenging to get for the average person. And, it's one of the many challenges of endometriosis.
Thank you for sharing all that. I feel like one of the things I loved about your website, and even as someone who treats women with endo, I feel like I didn't know everything either.
Mm.
Obviously, like you can't know everything and you don't know what you don't know, but your website provides so much information and visual aid. And I really appreciated that right off the bat. And I have your book on Kindle, and it's something that I will like go back to because I feel like something else that I appreciate about what you're saying is the treatment that you offer is also, or that you talk about, is so holistic. But I feel like also, tell me if I'm wrong, from your bio, I thought I read that you were on a holistic plan after your diagnosis, but it wasn't really getting to the root of the problem, or you were still feeling actually so fatigued, right?
Mhm.
And just,
Spinning
yeah.
wheels, I say, or like
Okay.
throwing mud at the wall to see what will stick. And
Yeah.
this is, I mean, if you are scrolling on Instagram, you could see why you could easily do that because someone's recommending a raw vegan approach and the next person's recommending carnivore. And then someone's recommending a yoga retreat and the next person is recommending a HIIT class, right? So what you're going to do is try a bunch of things because you have no idea and maybe you get worse and you end up developing joint pain or something else or diet is a bit of a quagmire because sometimes we start removing foods and that helps a little bit. So we become obsessed with diet. And if we just dial in the perfect diet, we'll be completely better, right? If I'm 25% better from just removing gluten and eggs, maybe if I'm a breatharian, I'll be 100%. So, I have a saying like diet can be the quicksand in which your healing journey dies in because you're not moving forward and looking at the huge picture that is not just endometriosis, but whole body health. Because and this was me, I thought endometriosis was like this foreign object in a way that was inside of me. Like I didn't
Mm.
know how it got there, but it was this foreign object. And I thought it was caused by estrogen. So I would say things like, oh, my body hates me. I have all these symptoms because of the endometriosis. The endometriosis is causing 99 different symptoms. And if I just continue to lower my estrogen, then maybe things will get better. um, that was that old-fashioned belief that it's caused by estrogen. I didn't know that you can have endometriosis and have low estrogen, and that can be causing your symptoms. You can have normal levels of estrogen, but you're trying to lower it so much you make yourself have, you tank your estrogen.
Mm.
I didn't know any of the nuances of the disease, and then when you start pigeonholing yourself in those ways. So um, there's lots who were like me. I say sometimes I wrote the book to me at 24 to help all the other 24-year-olds not make the same mistakes. Like,
Yeah.
let's do the cleanses. It's time for a liver cleanse. Now it's time for a candida cleanse. We're always cleaning the body like it doesn't know how to clean itself, right? Like, then we're doing all these gut blasts. So we're going to do an antimicrobial thing, even though our digestive and detox pathways aren't open. So we're making things worse and worse. I dug myself into such a health quagmire trying to get better before I could pull myself out. It was like the rock
Mm.
bottom moment in so many ways.
Mm.
And it's so unfortunate because I think doctors, their mismanagement of the disease leads some of us there. Like if we're not having help in the doctor's office, we think we don't need them. This is so dumb. We're going to go the holistic route. But we don't know what we're doing either.
Right.
So, no supplements are very little regulated. You could be taking 20 different things and doing a lot of damage to your liver. Nutrient deficiencies, right? Like my endo diet for me managing endometriosis was low-fat almond milk over like rice puff cereal, right? Like talk about nutritional deficiencies. And us with endometriosis are known to A, have severe nutritional deficiencies that can lend itself to establishment of endometriosis in the first place. It's related to pathogenesis, and it's definitely related to progression. So if you want your endometriosis to get worse, make sure that you are really nutritionally deficient, and chances are it can get worse. So um, understanding all of these things in the bigger picture, that we don't need to like diet ourselves into submission. We need to offer our body what it needs for absolutely vibrant health. That's not just through diet, it's through nervous system regulation. It's through, releasing muscular tension. It's through pelvic floor physical therapy. It's through movement. It's through community. It's through laughing, making new friends. Like all of these things have a place in your cells knowing how to behave. And then the beauty of integrative care, which is a term I use more often than holistic nowadays, because I feel like it allows us to fold in Western medicine as needed, because many of us do need a surgery.
Right.
I never needed one, which is very lucky because in Hawaii, we don't have excision surgeons. So I was looking at out of state prices, staying in hotels. It was like $60,000. So I am very lucky I didn't need one. Many women will. If you've had a diagnosis go, uncovered after 10 years, you could have some significant issues, and surgery will be needed to rectify it. So it's a big conversation, and there's a lot of different treatments out there. But yeah, the understanding what the disease is and making sure you're not throwing at the mud at the wall to see what will stick can save you so many years of of time spent, I guess, wasted time, right? Versus getting traction and moving forward.
Well, it's like spending the time learning what doesn't really work,
Yeah.
And
Oh,
it's
yeah.
it's all lessons, and I'm so grateful that you were able to like plug and play with what didn't work for you and then finding what did work for you. Can you I don't know if you can hear my dog snoring at all in the background.
I
It's kind of
can't.
loud. She's sitting right behind me. Can you talk about more of these like prongs of care that maybe helped you? I'd love to hear your personal story too, because obviously there's so many different ways that endometriosis can present. And I don't know, I feel like people listening to this would probably already know what endometriosis is, and I feel like you're giving a pretty interesting picture of it. But maybe if you want to define it
Yeah.
in more recent terms. And another piece I was thinking about was like, yeah, people don't know about it. Practitioners or people that are eventually diagnosed, they don't know about it. They don't know what to do about it because it's not as studied. But I feel like you've been able to find some research, and maybe, yeah, you can speak to that.
Yeah. Well, that's the problem, is that we hear there's no research. There's a few things we hear online that aren't true.
Okay.
One is this could create chaos, that we're born with it.
Mm,
That's not true. You can be born with an endo-like cell. Absolutely. That's widely known, but it takes a lot of steps for that cell to turn into an endometriosis lesion. So understanding those steps is important, because there's about 60% of women who are born with an endo-like cell actually don't develop endometriosis, but 40% will. So the research needs to look at why they're not developing it, right? Another thing we hear is that there's no research. We need more research. Well, we do need more research, but there's thousands and thousands of studies coming out every single year on endometriosis, and
great.
many of them are on treatment plans. So there's so much research, but there's this gap. It's called the research gap, and it's the admission that it takes about 17 years for what's discovered in research today to be known by a doctor in the future. So what is found out, my book basically, all the information from it, which took about 3 years of research and writing to do that book, in 17 years, doctors will know that information. They'll know that endometriosis is a systemic inflammatory disease that is more like autoimmune and cancer than it is a period problem. It's not rogue endometrial cells, right? It's like a completely different animal. But right now they're still looking at it like a period problem and treating it like a period problem. So you have to, as a patient, take it in your own hands, unfortunately, right? To know what the disease is and know how to advocate for yourself, which goes back to understanding what endometriosis is. It's not being a period problem, not being caused by estrogen. You can imagine it more like cancer. It's sometimes I hesitate on that because there's a cancer mutation associated with some types of endometriosis, and there's also a lot of anxiety in the endometriosis community that their endo is going to turn into cancer. So I'm not saying right now your endometriosis is going to turn into cancer. What I'm saying is that it's really similar to cancer. I think a lot of us actually understand cancer a lot better than endo, so we can use that to understand endometriosis. So for example, if you just think of breast cancer starts as a human tissue. It was not put there by an alien. It is not a virus or bacteria. It's a human cell. Genetically altered, epigenetically altered, right? Lifestyle factors like chemical exposure, inflammation make the cell rogue in some way. It's not behaving as it should. So it's up to your immune system to take that cancer out. And this is what a normal immune system does every day. It actually removes precancerous cells. Now, if your immune system is confused, called immune dysregulation, associated with autoimmune disorders, associated with things like eczema, psoriasis, it's also associated with cancer, maybe the highest form of immune dysfunction. Instead of taking that cell out, it establishes the cell into your body. It attaches blood supply and lymph. It's called neoangionosis. It's also a word that you would use for endometriosis. Basically, it creates that cell into a living tissue, and now you officially have cancer. Now, with the breast cancer, it also can be very sensitive to estrogen, not caused by estrogen, right? It was caused by all of these other factors combined together with immune dysfunction to create the cancer that is now sensitive to estrogen. That is the exact same thing of endometriosis, right? It probably started as an endometrial cell at some point. It could be inside your uterus. Us with endometriosis have endo-like cells within the uterus. And it's one of the things to consider for unexplained infertility is if there's an issue of basically these weird behaving cells in the endometrial lining, or they can be outside of the uterus. So this is where you can be born with an endo-like cell outside of the uterus. This happens as well. And then it takes a number of processes, including the absolute immune dysfunction, lots of inflammation, and these little inflammatory immune factors are totally confused. Maybe they think it looks like an endometrial cell that needs saving. Maybe they have complete dysfunction and they don't know what they're doing, but they attach blood supply to this tissue, the cell, so it becomes an endometriotic lesion or endometriosis. And then once you have that, then you officially have endometriosis. So it can be estrogen sensitive. This is where the estrogen picture again comes in. Estrogen is a grower. It signals grow, grow, grow to your cells, which is great if you are in your proliferative phase of your cycle and you want to have a really nice plump endometrial lining for an egg to implant in, but it's not great if you have rogue tissue outside of your uterus that can cause damage of the tissue, surrounded also by things like bacteria and all of these inflammatory factors that we see within the peritoneal cavity of the endometriosis sufferer, and it can just become worse and worse. So estrogen is one factor of many with the endometriosis diagnosis. And when we shift our perspective, right, suddenly it's like, oh, estrogen isn't like the one thing I need to be looking at. It's really immune dysfunction and the entire body health, because we see like what other factors influence the disease, like influence the lesion specifically. I could just list a bunch of like cortisol, adrenaline, too high insulin, too high glucose. You have nervous system dysfunction, bacteria. I call it the smoking gun behind endometriosis. You can have bacterial overgrowths all over your reproductive tracts, your vagina, your cervix, your endometrial lining, your fallopian tubes, your peritoneal cavity. We can have it in our mouths, in our small intestine, our large intestine. This is specifically for endometriosis sufferers. We have so much dysbiosis throughout almost our entire body, and it can translocate to the specific site of the lesion. And now bacteria could be provoking our lesion 1,000 times more than estrogen, right? So there's this, it's a huge conversation going on, but everyone's just pointing at estrogen in the Western world like it's the only thing that could possibly grow a lesion. And that's one of the reasons that endometriosis has become a catastrophe, because it just doesn't affect everyone the same way, right? We all have different levels of estrogen and we all have different sensitivities in our lesions. So it may not affect me at all, but someone else can have highly sensitive estrogenic tissue. So that's kind of a long-winded way of explaining how it is like a really big disease and it's much different than a period problem or an estrogen issue.
Absolutely. I'm glad you clarified that further along those lines because I feel like a lot of times people are coming to me with period questions, and if they have endometriosis, it's like, okay, wait, like let's show you Katie Edmonds' book because this really opens your mind. And I feel like in a way that would um give them hope,
Mhm.
because it isn't just a hormonal estrogen issue. It is multifactorial, and you can come at it from a multitude of places. Um, and yeah, yeah. So
Hope
it's
is hope is the biggest thing. So this is the really cool thing about endometriosis that I didn't even know until I started my research. I just assumed there was no research on it. Is that endometriosis is more likely, according to the research on humans, not done on mice, not personal opinion, on humans is more likely to regress or stabilize than it is to progress. So there's a
mm,
number of studies. I think I have 4 or 5 that I have found that show this, and they are all the same. There's no study that I've ever found that shows that endometriosis is more likely to progress than stabilize or regress, which is so, I guess, crazy, just to use a casual word about it, that no one's talking about this. So if you look across the studies, it's a really similar amount too. It's except when it comes to rectovaginal endometriosis. So that'd be like bowel endometriosis, and that's like 93% more likely to stabilize or progress.
mm,
Or I'm sorry, to stabilize than it is to progress. So it's a huge amount. It's like, 93%. If it's inoperable bowel endometriosis, you might as well be okay unless it's symptomatic and you need to get it removed. But as for other types of endometriosis, it's about 30% seem to stabilize. So that means the lesion is not growing. It's not turning into worse forms of disease, which can happen, more aggressive,
mm,
more painful. And it's not turning into a progressive with scar tissue and adhesions, which is the damage you absolutely don't want, especially if you want babies. You really want to preserve all of your organ function, of course. So that's stabilization. Now, progression rates were exactly that. They're 30% as well. So you don't want to progress for those exact reasons. And then as far as regression, the lesions are shrinking, happen to 40%
mm,
of the lesions. So 70% total regressed or stabilized, 30% progressed. So what that shows, or I guess, and of these studies, not a single one was looking at why. They were just tracking. They weren't saying this is what happens when you do this lifestyle or you use this medication on your own. Your body, you want it to take back control over the endometriosis. And the regression of the lesions is your immune system functioning normally. They're not disappearing because of a magic Harry Potter wand. It is your immune system starting to function well, and your immune system heals things, right? Like if you cut your arm really bad, then you don't get stitches. You'll be able to watch it start to mend the tissue and heal it back together. That is what the immune system does when it's not attacking things with inflammation. So when your immune system stops attacking and it's able to repair, you can see lesion regression. So that to me is like the most hopeful information to spread. Unfortunately, some people get mad about that information. I think in a community where people have been gaslit a lot, they can
mm,
say, let's not take this disease lightly. 30% progression is not okay. Absolutely agree. Absolutely, right? But when you have so many women who can afford an excision surgery, who aren't getting the care they need at doctors, and you say, if you can get your body on the right track and re-regulate your nervous system, your immune system, your gut, your endocrine system, like I call it, a whole body ecology, fix your body ecology. What if your body could take care of endometriosis? And that is what happened in my story. Is I say I accidentally found remission because I was trying to get pregnant, and I did all these things, so much of which I researched and put in my book: diet, movement, nervous system work, et cetera, saying I just want a baby. And what I found a year and a half in is my endometriosis was in complete remission. I don't know if the lesions are there. I've never done imaging, but symptomatic remission. And since then, I've had 2 babies naturally. I was told I couldn't have kids before. I should have a hysterectomy and adopt, which is like a terrible thing for a doctor to tell a young woman.
a 24-year-old. Wait, okay. At what point age-wise did you start trying and you were experiencing infertility, or you just
Yeah.
got pregnant? Okay.
Yeah, I was 29 when I started
Okay.
trying, and it took us like 3 years to get pregnant.
And when you say you had your symptoms go away, you were asymptomatic,
Yeah.
it wasn't confirmed with images, but you weren't having painful sex anymore, I would imagine.
I had pain. It was funny because my endometriosis was pelvic pain nearly all the time, except during my period.
I've heard
Which,
this.
yeah, it's a kind of a rarer one. But yeah, it was like chronic pelvic pain. I couldn't do anything that like jolted my pelvis, like
Mm.
running. I used to be an avid runner, couldn't do that. Like the thumping would hurt my uterus. So I might have adenomyosis as well. I was never diagnosed, but I do have symptoms of that. Um, and then all of these other symptoms like chronic fatigue, just total inflammation overload in every single way. And as I said, I thought endometriosis was causing 99 symptoms, but then when I started to shed the symptoms, I realized I had 99 problems and endometriosis was just one. I had crazy blood sugar dysregulation. Like my sleep was nuts. I was drinking alcohol to at night to come down from all the coffee that I needed during the day because I was so tired. I was mouth breathing, right? I wasn't nasal breathing. My muscles were so tense and underused. I just started walking barefoot. And then I started, I had read a book about natural movement and how this woman who started walking 5 miles away cured her pelvic pain. And I was like, well, I'll try that. So I started walking 5 miles a day. And it was all these things, one after another, things click, 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 click. My periods became normal. The pelvic pain disappeared. The pain with sex disappeared. All the inflammatory issues disappeared. I say the clouds lifted across from my eyes, like I was seeing the world anew from this brain fog and chronic fatigue.
Wow.
I was like a person born anew. And then I got pregnant. Like my body fixed itself to the point of getting pregnant because endometriosis wasn't causing all of those things. All of those things were contributing to the endometriosis. And yes, endometriosis becomes a part of the puzzle. And for some of us, that's why we actually need to remove it because it can actually be contributing to the inflammation. Like it can create inflammatory immune factors. Endometriosis lesions they make mast cells and histamine. So if you have, a lot of endometriosis that's very active, it
Mm.
can produce estrogen, produce histamines, produce mast cells, produce inflammatory immune factors. So a story like mine might not happen without a surgery for someone, but in my case, I was able to fix it without that intervention.
Yeah, that's what a blessing. And
Mhm.
your pregnancies felt how? Like, how did they feel while your uterus was growing and taking up more room? And I mean, obviously, yeah, not obviously, but go ahead and share.
Yeah, well, my second was a surprise actually, which is so
Mm.
funny. How you try for something for so long and get it, and the next one, it was a shock, I will say. We weren't expecting that, and so it took me a while to like get to be okay with that. And I think that's okay. Everything in life, surprises can knock you sideways, and
Mm.
it ends up being lovely, a lovely, wonderful surprise. But both pregnancies for me were absolutely fine. Although this is my birth with my first one was terrible, like absolutely terrible, PTSD inducing. And I did research on this. So actually, it's a great question to ask for women who are pregnant or looking to get pregnant with endometriosis. So I had scarring on my cervix. Now, you can get scarring on your cervix from too much inflammation. I had actually endometriosis lesion on my cervix, and the
Mm.
doctor burned it off.
Yep.
So it could be inflammation that girls who have HPV scraping can cause scar tissue and also IUD insertion. So when you have scarring on your cervix, remember your cervix is like super closed tight. And by the end of, by the time the baby's born, it's got to be flat and wide, super wide for that baby's head to come out. So, it has to grow the 10 centimeters, which is easy if there's no scarring and you
Mm.
can move, but if you have scar tissue, it can get stuck. So there's the level of pain right before you give birth is called transition level pain. It's where you're puking potentially. It's like the worst pain, but should only be for a little bit of time before you give birth. For me, that started at 1 centimeter. So
Wow.
I was in severe, severe pain for a very long time, for like 20 hours.
Oh, girl.
And that it can be. So with my second labor, I learned from this, and I had a midwife. And I told her about my story, and she said, "Well, you can do so much." And she had me insert GLA capsules, so essential fatty acid capsules, for the few weeks beforehand. And then since I was already pregnant, she said, once you are in labor, I will massage your cervix to see. So when I was in labor, I was at like 2 centimeters and she did an internal exam and she's like, oh yeah, I can feel some scar tissue, probably from my first labor or from whatever I had, was still there.
Mhm.
And she was able to massage that scar tissue and release it. And I went from 2 centimeters to 4 centimeters within two contractions because she released it. So for anyone who's pregnant and a little concerned about that, I had a home birth, and if you go to the hospital, they will pressure you for stuff like a C-section, right? They're going to look to do the things to advance your labor quickly. They don't want you there for 36 hours. They don't have time for that. It can also be, harmful for the baby. I had a home birth. They're monitoring. I felt like I was dying, but little baby was okay. His heart rate was fine. But if you're in that situation, I would talk to your midwife or your doctor and get them on board beforehand to have them ready to massage out and then use the essential fatty acid tablets right before, insert them every day.
I've heard castor oil too,
I've
like
heard that. Yeah.
yeah, like in a soaked tampon, just inserting, letting it be there for 20 minutes. You could massage it yourself. You could let your midwife or your doctor also massage if they're aware. I've heard stories too. I'm so grateful you shared this because more women like around our age have had those kinds of procedures
Yes.
or have had those kinds of birth control, things. So it is more likely that some of us will have
It's
a certain
common
amount of
now.
scar
I know
tissue.
I have like a whole handful of friends that have had that type of thing now, and so I try to talk about it. Like,
Yeah.
and a lot of women are, well, they won't pay attention to it because it seems weird. But yes, if you had scraping or
Yeah.
or even just any infection, like if you had like a bad vaginal infections that could scar that tissue, just to know about it.
Totally. I feel like the midwives too, who are so they have had so many births that they've supported, but it's
Hmm.
not a part of their intake forms yet.
Yeah.
But now it's kind of coming into play for them to realize 17 years. I'm just kidding.
Probably, right? Yeah, because we were all getting HPV tested, I think, what, like about, yeah, college was,
Yeah, like
yeah, it's like 20 years
2008.
ago. Yeah.
Yeah, totally. Oh my gosh, that's actually quite funny.
Told you.
Oh yeah, exactly. Oh, you're spot on. So spot on. Okay, yeah, no, thanks for clarifying that because I wasn't sure if you went through with the vaginal birth, but you had both vaginally.
Yes,
And
yeah,
okay, okay.
at home.
And then I guess something to hit on too with endometriosis. I had two questions about your postpartum and the return of your period. And even though endo is not a period problem, I would
Mhm.
assume that I mean, I think of postpartum kind of as like this longer menstrual phase. It's a very like inward
Mm,
phase, and there's a lot of healing to be had. And yeah, I was also wondering about these women who have already, say, had like a hysterectomy. I do want you to speak on the surgical side if you're able to.
mhm.
Um, the misconceptions maybe, and then um the things you got to think about if you do choose to go through with one.
Do you, okay, so you want to touch on the postpartum
I want to hear about your
first?
postpartum. Yes, yes, yes.
Okay,
Let's
and then
start there.
surgery second.
Yeah.
Okay. You know what? Postpartum for me was really, really hard with my first. Actually, the birth was so hard, and I felt extremely traumatized from it. It was kind of like I felt like I was in a Saudi torture camp for 24 hours. And this is after reading like Orgasmic Birth and let's think of contractions as rushes, with Ina May, all these home wives and stuff, whatever. And
Yes, yes.
I was like, that was awful. Like I felt it was like the worst thing I had ever experienced. So it took me a while to recover from that. And I think because of that too, my pelvic floor felt really bad for a long time.
Mm.
And I checked for a part prolapse or anything, and they all said no, but I felt this heaviness in my lower abdomen that just wasn't there. And I learned a lot from my first of I think with endometriosis, there's so much inflammation in the pelvis, and there's so much that we've dealt with that can be slightly damaging to the tissue, the connective tissue. I think we need to be a lot more gentle on ourselves and someone who can bounce right back. Have very active friends on Kauai that were able to just get on with life really easily. And with my second baby, I did it's like 4, 4, 4, 4 days in bed, 4 days just walking like to and from the bathroom, and then 4 days only walking around the house. And my mother was like, why, when can you walk again? Walking is, it's how you heal. I'm like, and I learned that from the last one, Mom.
Interesting.
And I felt so much better doing that. It's not, our society, of course, is like bounce back as fast as you can, don't need anyone, don't ask for help. And you talk to the average endometriosis sufferer, and they're going to be even worse on that. I don't need help, I'm totally fine. There's a lot of like, I can do it mentality, even if we're like suffering and underwater. And so learning to ask for help was one of my greatest learning lessons. Was you can't do it alone postpartum. It is exhausting. You are up all night breastfeeding, like all night. And people told me that, and I thought they were like over exaggerating. And you're like every hour and a half, like you have a 45-minute feed that you are up all night, and that's for weeks on end, right? I didn't know I was getting myself into. And, I love equality of the sexes. I love all that stuff, but no one told me that it is really that intense. And I don't know why. It's almost like people say, oh, you'll get through it. But if I had more forewarning, I think I would have been better prepared for it. And maybe it was my naivete, because some women are fine. Like, of course you're going to be up. I just wasn't thinking that direction. So my first postpartum was hard. My second one was so much easier. I wasn't worried. You realize babies aren't as fragile as you thought, you realize they're like, it's hard to kill a baby. I hate to say that, but like, you don't know what to do with the first, and you're like, am I going to kill it at any second? And the second one was like flinging them around, handing them to the 3-year-old. You're like, you just sit at, they're fine. And so the second was so much easier. I was gentle with myself. I was gentle on the family. But postpartum is a hard time. And if someone does start developing endometriosis symptoms again, which I didn't even have to deal with, but some women are getting them back right away. Like they're getting their period within a few months. And then they're dealing with chronic illness on top of postpartum. So that's actually something when I've had clients before. So I no longer take active clients, but I was taking clients for a long time, and I would get women coming to me almost on death's doorstep. They were really, really sick. They felt terrible, but what they were trying to do is get pregnant. And it is the most important thing to give yourself the foundation of health as much as possible before you get pregnant. Even if you're 38 and you're thinking, well, if I don't get pregnant right now, I'm going to miss my opportunity, because there's a lot of women who are waiting a lot later. And I argue you'll get pregnant a lot easier if you have that foundation of health first. And it's really hard. Like having a baby is not a walk in the park. It's a very beautiful romantic idea, but it changes your life forever. And you want to be as healthy as possible for after, so that you aren't dealing with chronic pain and terrible digestive issues. Like you can sleep in now 3 days a week and you have a late work start and your husband helps you. But once you have the baby, that's going to really change. Like you need to be able to not have to sleep 12 hours a day to function, right? So it's just a good reminder to build your foundations of health as much as possible before you get pregnant. You won't regret that. It's time well spent.
I love that. I love that reminder. Um, Now, okay, aside from the surgery piece, it's making me wonder about perimenopause and as the period starts to waver and essentially and eventually go away. I wonder, I mean, this is part of the piece or the question about surgery, right? That I've heard other people talk about it, and I don't, not going to say that I know everything about it at all, but what I have heard and something that I feel like is true is even though you have surgical removal of, say, your uterus or any lesions to prevent any more lesions from happening, it's not always going to happen that way. Is that true? Is that right? Like according
Yeah,
to what you're
so there's different types of surgeries first. Should I just go into the surgical thing, because there's so much there.
Yeah.
So if you have endo, you'll be offered, it's called like a generic ablation surgery with your gynecologist, same person who's delivering babies. And they use a burning method called cauterization to burn the lesions off. And they're the ones who will also say, if you're not having success, you have a hysterectomy and that will stop it. But they'll say you can have a hysterectomy without even removing the lesions. So your endo lesions would remain. They're just removing your uterus, saying, okay, now we'll stop the period. So that will stop your problem. So this is the thing that endo can grow back really fast. I had 2 of those surgeries and the endometriosis grew back within 10 months because the root of the endometriosis is there, right? There's like some cells, so a little bit of leftover tissue. And, it's like trimming a weed versus plucking a weed. They just trim it off. So it grows back within 10 months. And I was like, exactly at 10 months, my symptoms came back. So there's a gold standard surgery. It's called an excision surgery with an expert because there's people who do excision surgeries who are not experts. Really important to find an endometriosis expert surgeon. They use a laser that is, you can burn the ink off of a dollar bill. Like that's how precise it is. They go in and they remove the endometriosis lesions, everything they can find from the, root to tail. It's all of it, the whole lesion. So that the hope is that it never grows back. They're women have amazing success with this if the endometriosis itself is the main driver of their problems. And then for adenomyosis, so that's like endometrial-like or endometriosis-like tissue growing within the uterus, the treatment for that is a hysterectomy, the overall treatment. But that doesn't mean you need to do that. That would be like for severe cases. Women with adenomyosis get pregnant all the time. It doesn't mean that you're damaged forever. And it can grow and shrink too, just like endometriosis. You can shrink it and make it smaller or disappear as well. So surgery about 10 years ago came onto the scene hard with Endo What, which is that documentary that says there's poor types of surgery, but there's this gold standard surgery that no one's talking about that can change lives. Really impactful, really important. But there's some really big problems. And one is that in some endo circles, the surgery is seen as necessary for everyone. They think everyone who has endometriosis needs a surgery. And that's what we hear. That's part of the misinformation that's pushed out there. You have to have a surgery. 2, it's not covered by insurance. Very few are. Very few endosurgeons are covered by insurance. The problem is your insurance doesn't see a difference between the 2 surgeons. So they're going to say, oh, there's your cute duck.
Yeah.
They're going to say, we'll pay for a normal surgery with, the cheaper doctor, and it's only going to take 45 minutes. Your excision specialist says you might take 6 or 7 hours. We can't afford that. Plus all this pre-op care and post-op care they offer that's really specialized. So maybe they'll reimburse like a few $1,000s, but your surgery itself can be like, $50,000 or $60,000. Now add on to that, there's only about 200 excision specialists in the world. So I did the math. It's something like it would take over 100 years to get through all of the women who have endometriosis right now. And not including the ones, we're already dead, not including the ones that are coming. So, and here's the other thing is that some groups are saying that endometriosis excision surgery is a cure. So it leads women on this wild goose chase. I have endo. I absolutely need a surgery. I will pay anything to get it because it's the only cure. So that is a huge, huge, huge problem right there. We see that some endometriosis regresses. Some women may not need a surgery. They may be able to regain their quality of life. They won't have progression. They'll be okay. This is like I consider the me's of the world. I am okay without a surgery. Then there are women who will need a surgery, absolutely, but they will be far from cured. They also have SIBO. They also have pelvic floor dysfunction. They have crazy nervous system dysfunction, right? They have chronic pain because of central nervous system sensitization, which means your nervous system now has responded to pain for so long that the thing causing the pain isn't there, but your nervous system is still firing like it's there. It's like phantom limb pain.
Right.
And it doesn't mean that the pain is in your head or you're crazy. It means
Right.
you're having real pain, but for a reason that's not what you think. So you need to actually retrain that central nervous system. There's so many factors, right? So when you get into this very pigeonholed, oh, it's just the lesion is causing the issue. And if we remove the lesion, we cure the body. You say, no, endometriosis is a full body disease beyond the lesions. Remove the lesions and you still have radical imbalances throughout the body, from your endocrine system and your immune system to your gut to your nervous system. All of these systems are out of whack. And so some people need so much care on top of surgery, right?
Mm-hmm.
And they can feel hopeless if they have a surgery and they feel worse because their doctor didn't address the fact that they were thumping full of inflammation. And the surgery was so hard on the body that it put them into like a thyroid disease and their hair fell out from stress. I have been reached out to by women. I lost all my hair after the surgery because my body was so stressed. I cannot heal. Because, if your body is already has, your inflammation bucket overfloweth, so to speak, and you add a huge surgery on top of that, wow, you were not ready or prepared for that surgery, and your doctor took advantage of a situation, right? So
Mm.
you need to be working with a doctor who understands integrative care. There's a lot of, great surgeons. Dr. Iris, she wrote that book, Beating Endo, and she talks about she likes to lower inflammation with her patients 6 months before they do the surgery so that they have a much better surgical recovery, right? There's the Endo Center in Atlanta. They have a full holistic integrative care portion of them. And same with Dr. Cook, who wrote the surgical chapter of my book, that you want to have a healthy body and remove the lesions. That is what you're looking at for remission. Now, if you have a very unhealthy, very sick body and you remove the lesions, you can get worse or you can stay the same. Yeah, you remove the lesions, but are they going to grow back faster? Like, are you more at risk for developing other autoimmune diseases? Us with endo are, right? There's all these associated diseases because inflammation and immune dysfunction let go, it can run rampant for years and years and years, will cascade into other diseases. We can have 3 or 4 autoimmune by the end and say, what am I doing wrong? And it's because no doctor has ever allowed us to see that we're not on a healing path, but we're on a progressive path, by sticking us in that medical realm, right? We're like not allowed out. So when we take away, okay, surgery is an incredible tool, and we are so lucky to have excision surgery. The invention of it has changed lives, but know that the tool is there. It's not necessary for everyone. It doesn't come without risks, and endo can grow back even with the best surgeon in the entire world. So I want it to be seen as a tool in the tool chest, still in an overall hopeful frame. Not to say, oh gosh, I thought that was my thing. I want to say it absolutely can be. And I wish I could talk one-on-one with every endometriosis sufferer who came along to like put their fears at rest. Some people I talk to off the bat, I'm like, girl, you have to go get a surgical evaluation. I can't believe you haven't yet.
Mm.
And others, I'm like, oh gosh, you could do 5 things in the next 2 months and you might feel you're not doing like anything that I could see that would be impacting your endometriosis positively. So let's switch that
Mm-hmm.
and take a look, right? So every case is going to be unique, and we have to remember that as patients, and we're not just unique in our symptoms. And I don't think I've said this on this podcast yet, but there's over 65 different types of endometriosis. So we can have completely different types, and some of them are fast growing, and some of them are slow growing, and some of them are painful, and some of them are associated with infertility. So we just have to be gentle with ourselves and not compare our journeys to others as much as we do online. Like, oh, that worked for patient A, so I'm going to try it. Oh, she's a liar. It doesn't work. I'm going to try what patient B did. And you say, oh, they're not lying. These things worked for them. Again, throwing mud at the wall to see what will stick, or you can just really start to listen to your body and zone in on the symptoms. And that's what I try to do in my book, is say, look at your own body. Stop looking at other people's bodies. Like, where's a place you could start? Do you have chronic anxiety? Start there. Like, high levels of cortisol and adrenaline throughout the body throughout the day progresses the disease, not just symptomatically. It is actually a disease provoker. Like, do you eat tons of processed foods and no antioxidants? That can progress disease because you can't stop inflammation without antioxidants, which is why an antioxidant-rich diet is so important, right? There's all these little things you can do. And with the book, I hope to put the power back in patients' hands, that they're not looking for someone to heal them. They're saying, I can heal myself. I don't have the information. I can partner with people to help me get me there. But at the end of the day, I'm taking radical responsibility for myself and for my future.
Oh, thank you for saying that. I am a huge fan of those just wanting to take some responsibility and not without help and support, because you
Right.
can't, sometimes you just can't do it
It's
alone.
so hard
But
to
it
navigate
is
without help and support.
right, right. But it is up to the person to make the
Mhm.
changes and to know their body well enough to see what is working, what's not working. And yeah,
Yeah.
I'm so glad you said that. Because anyone with a chronic illness, and I mean, it could range so big there, right? But specifically endo, yeah, it's like, this is your body, this is your life. Like, let's have you living the most vibrant life possible. And
Hmm.
it's not like I still find it so fascinating that you wish that you had a cancer diagnosis instead of endo because of
Right?
the languaging and the conception around it, and the hopelessness that's there. And I think also on your blog you are utilizing words like remission and things like that for endo because it is possible and you can feel vibrant, you can feel
Mhm.
pain free, you can have pain free periods, pain free sex. You don't have to have all these other things going on, but it does take some diligence and devotion, I think, to the body.
Yeah. I say it's a huge difference in perception. Growing up in the 90s, I read Cosmopolitan, and there was always like the new diet, the 30-day challenge, right? And that like really put something in my head. Like if I do something for 30 days, I'll be better. Like 30-day Candida cleanse, go. Like it was these things, and then you realize after time, it's your whole life is contributing to the dysfunction within the body. Not saying it's anyone's fault. It was never my fault that my everything I was doing, from all the chemicals I was putting in my body to the food I was eating, the way my nervous system was responding, none of it was my fault. But I had to change it in order to get better. And that is not a crash diet. I say you want to work on baby steps, which sounds boring, but in 5 years, you don't want to be reminding yourself, oh God, I got to drink my water. I've had clients who just cannot seem to figure out how to stay hydrated, because they're so busy looking at the next thing, looking at what
Mm.
else can I do to be healthy. And so we literally have to be hydrated in order to detoxify stuff out, to keep your constipation at bay, like all these methane SIBO sufferers. And that's just one thing, right? So you want to integrate lifestyle habits into your life so that you're not constantly like living on a health spiral, like
Mm.
just spinning and spinning and spinning. And doing a lifestyle change is different than a crash diet, right? So you have to excel and be really good at something before you move on. Like adding organ meats to my diet took a very long time to really master and not think about it anymore, right? You can't be running all these different tabs in your head thinking about it for you. It has to be your lifestyle. And my lifestyle now is I never think about going to the farmer's market and grabbing my fresh local produce for the week and the exact store that I get my local ground beef, and like knowing how to process organ meats. It was like learning a new language. Like I was a vegan for 10 years and a
Mm.
vegetarian for 15. And so learning these new habits was big, and it was tricky. And sometimes it felt icky. It felt very icky facing like the emotional roller coaster in my brain that I had decided to completely ignore, and had no idea I had anxiety, because I was like, oh, I'm fine, just totally, totally fine, just like a little neurotic. You know, these things are uncomfortable, but if you keep working on them, you become a better person, more gracious person, and life is better. You want life to always be better, right? If we're going to live to 90, let's be wise, amazing people. Even if we can only get our endometriosis into partial remission, let's be like really great in the process. Let's learn a lot. Let's have a growth mindset. Let's have fun and enjoy it. And that is very different than the control factor. Like I said, the getting stuck in the quicksand of diet where you're just controlling more and more. It's a whole different perspective, right?
Totally. I could imagine that on some or many levels of healing endo, this journey would be uh, huge questions of identity
Mm,
and whether you identify as an endo sufferer or a vegetarian or a vegan or someone who had anxiety like for so long. It's like kind of coming back to the responsibility thing, and it isn't your fault, but like the words even fault or blame and where you're going to place
mhm,
that, and having that different mindset shift or perspective change on those even words and the weight of those words into responsibility and
mhm.
reclamation and choice. It
Words
does.
are important, right?
Yeah.
Do you, right? Because I absolutely believe it's so important, your word choice. It's so important what you feed your brain. If you're feeding a blame and you decide you're not to blame, but you're still using the blame word, you're going to start blaming your parents. You're going to start blaming, you have to literally end the blame cycle and move to rejoicing, move to forgiveness, move to trust, move to what the hell, here we go. I'm brave, whatever. Like,
Yeah.
it's a complete. it's switching your mindset from living in the disbelief mindset to the belief mindset. It changes everything.
Right, right. Oh my gosh, I feel like that's a really hopeful note to end on or start to wrap things up a little bit. But I guess I wanted to ask, like, two questions. How do you feel in your body to this day, like right now? And is there anything else that you just would want to share with anyone else wanting to learn more about their own endo, or if maybe they know someone with endo, and give some encouraging words that you haven't yet shared?
Oh gosh. Yeah. Well, my body now is like it's a living experiment. I'm 39, so I just spent the past 15 years thinking about fertility and babies and periods. And now I'm like, wow, I'm probably looking at perimenopause here soon. So with a growth mindset, I'm excited to learn more about that because I haven't really dug into the research into that. And I know that's like a blossoming field right now. So that's pretty cool.
Yeah, it makes
Um,
sense.
and for anyone who's just out there with endo and you feel like maybe a lot of this is over your head right now, or you know someone who has endo, you just want to learn about it, honestly, read my book. And I hate to just like, shamelessly plug, but the
No.
book is I've heard it referred to as like an endo Bible. People keep it by their beds. It's a reference. I'm not trying to sell you my things. I'm not trying to sell you supplements. I'm certainly not trying to sell you can cure this with lemon water and sauerkraut. There's nothing like that. It talks about all the specifics of what endometriosis is, and it's an absolutely amazing treatment plan. There's over 500 citations in the book. The forward is written by the head of the Endometriosis Foundation of America. Has been translated into 4 different languages. So it is like it is a comprehensive understanding of endo and how to know it, heal from it, live with it. So check out the book would be my recommendation. It's like $23 on Amazon.
I seriously highly recommend. If you happen to have a Kindle, I ended up buying a Kindle last year, and I bought your book there because I did have a hand copy from Corey, but then I had to give it back to her. So I'm like, I cannot be without this book.
I'm
Like, just in
so
case.
so honored to hear
It's
that.
just no, it is a fantastic reference source for me. Like, I'm so grateful that you put in the time to write it. And I mean, it's been out for a little while, right? Like a couple
Yes.
years, few
Yeah,
years.
2 years.
Yeah, yeah. So I'm so happy to have had you on and to share about it with more people. I think what you have to say about it is incredible. And oh my God, I don't know why I'm thinking about this right now, but I'm so curious if you know what human design is. And um, do you know what that is at all?
No.
Okay, we can talk about it off air, but essentially, I'm just questioning whether or not you have a sixth line in you, which is a role model. And part of the six is you live your life as a third line, and the third line is very trial by error, trial by fire. You do all the things, and then it's part of your karmic cycle, your life's karma, dharma, whatever you want to call it, to then be the role model and show people the way. And that's what I feel like you're doing.
Well, I made all the mistakes so that you don't have to.
Exactly. You said, like, these are all for all the 24-year-olds who don't want to go through the same path that I had to go through
Yeah.
to figure it out and piece it together. So, Katie, thank you again so much. I'll put all of your things in the show notes so that people can have easy access. And
Awesome.
yeah, thank you
All
guys
right.
for
Thanks for
listening.
having me.
Of course. Bye, everyone.